Hello, this chapter is going to cover additional diagnostic imaging techniques and talk a little bit more about the staging of cancer and surveillance for metastases. So, as we all know, mammography, both 2D and 3D, which is tomosynthesis, is the most widely used and accepted as a method for screening and the first step in further workups. Patients will be called back for additional views if needed, such as magnification views or cone views. This is a quick exam, mammography is. It's available at all imaging centers pretty much. It's cost effective, it's very affordable, and it is easy to demonstrate solid tumors and microcalcifications with this technique. The weaknesses of mammography is that there's a difficulty seeing through very dense breast tissue, thus the use of tomosynthesis so that you can look at very thin slices through that dense tissue, and also the exposure to radiation is a downfall of this technique. So on a mammogram, your breast cancers are going to show up as white. The more glandular the breast, the more difficult it is to isolate the cancer because the glandular dense tissue shows up as white. So therefore, it's easier to miss these cancers if they're hiding in that dense tissue. A BI-RADS D density is someone who has 2 to 4 times higher than a person at average risk because of the density in their breast. So ultrasound has become the most widely used adjunct imaging technology, especially for these dense breasts. It's not recommended as a standalone screening tool due to the inability to detect microcalcifications, however. Ultrasound, as we've discussed in prior chapters, is very operator skill dependent, and sometimes it's difficult to provide those reproducible results like you can with mammography or MRI and so forth because of that operator dependency. So women with dense breast tissue often are recommended to have screening breast ultrasound. What we call today is a whole breast ultrasound exam. It's automated. The machine provides the pressure onto the breast and maintains that pressure, and then it moves automatically across the entire breast. The ultrasound companies responded by replacing the small field transducers that we used for focused breast exams with this more automated scanning system. We call ABUS for automated breast ultrasound scanning. Okay, so we have other imaging technologies that are used for special applications, a contrast enhanced mammography, CEM, scintimammography, and then PET, a positron emission tomography. So contrast enhanced mammography requires the injection of an intravenous contrast agent, just like we do for a CT scan. So it doesn't make us very happy in the mammography world to introduce this risk into the exam and this expense into the exam. It is not being widely used, but it is probably in some academic centers being used. It has 2 ways that you can use the agent. You can do subtraction type of technology where you do your base images first and then you do your post-contrast images similar to what we do with an MRI. Or there is dual energy. Dual energy is going to require immediate exposures. The images are going to be processed with special software, and there may be hardware involved at a high energy level and a low energy level. Scintimammography is also called molecular breast imaging or breast-specific gamma imaging. It's a nuclear medicine procedure. The patient is injected with the radioactive tracer material, and then the uptake of the tumors in the breast are then displayed via the nuclear medicine camera. Sentinel node localization is looking for the primary node or nodes that will metastasize first. So we're looking for those nodes to be identified for the surgeon in case they need to go after those nodes during surgery. It requires the use of a radionuclide injection to find the first nodes that receive this lymphatic drainage. Also, they will inject some blue dye for the surgeon to easily find it. They'll usually go to those nodes and resect 1 to 2 nodes and then look for cancer in those nodes to determine the treatment path for the patient. PET can be done with a dedicated PET system, as you see here, specifically for breast. This is the better way to go for breast than an all-purpose PET scanner, but there's probably not a lot of facilities that would invest into such a specialized piece of equipment. It can be done, breast PET scans can be done on the conventional all-purpose PET or PET CT scanner. As you know, positron emission tomography requires the injection of a radionuclide labeled with a sugar-like molecule. That is why the patients for this do not want to be on a high sugar diet before they come in, so that the uptake is appropriate. And then the molecule concentrates in the areas of the breast with the increased metabolic activity, and that is what we see when we do the scan. Cone beam breast CT is a true 3D with 360-degree imaging. And the way that this works is the lady lays on a table, her breast falls through an opening, and the CT scanner actually does a 360 rotation around the breast to make those exposures. It can be done with or without contrast. There's no compression. The breast just hangs there. It is a low-dose projection images that are done in about a 10-second sweep. This too is a technology that is not in clinical use. It's mainly being used in academic centers. So, to talk a little bit about breast cancer staging, distant spread of disease requires us to do additional measures and additional therapy. The most common sites for the spread of breast cancer is in the lung, the bone, and the liver. The confirmed malignancy triggers the following tests that we will use to look for metastases. Obviously, if we're looking for the lung, we're going to do a chest x-ray, which could be complemented or followed with a chest CT. Bone, if we're looking at the bone, most likely the patient is going to have a bone nuclear medicine scan. And then if we're looking in the liver, we'll usually use a liver CT and ultrasound, sometimes MRI. So the breast cancer gene test that is commonly being done today is a gene test looking for BRCA1 and BRCA2. It's a blood test to check for specific mutations to these genes that help control normal cell growth. The BRCA1 and BRCA2 produce tumor suppressor proteins which help repair damaged DNA. So if these BRCA1 or 2 genes are found to be mutated, DNA damage may not be repaired properly. So it can lead to the uncontrolled cellular reproduction of these faulty cells. And these are the patients that, if they are determined to be at high risk, may, instead of doing mammography, screening mammography, would move to breast MRI. In some cases, patients will alternate mammography with breast MRI or replace mammography with breast MRI. more and more insurance companies are covering the MRI if these patients have proof of being at high risk. So that does it for this chapter. Thank you very much.